Hi, my name's Wilma. I've been a nurse practitioner for the past 30 years. I started out as a neonatal nurse practitioner in Boston and then moved to New Hampshire and wasn't anywhere near a level 3 NICU, so I started doing pediatric primary care, which I did for nearly 23 years in a little rural medical home where we did from birth to acquiring your adult role primary care, as well as attending deliveries, admitting to the hospital, and even doing school-based clinics. And then for the past 3 years, I've worked at Dartmouth in a specialty clinic and a child development clinic, just being able to evaluate children that have developmental differences. In terms of healthcare economics, I'm very curious about how healthcare funding drives decision-making for nurses. I first came out of school where there was no insurance for the vast majority of my patients. Not in the NICU. The NICU was covered, but in the primary care, we used to have a goldfish bowl where we would help pay for patients amoxicillin or albuterol. And then the healthy kids came out and almost all of our children now are completely covered for insurance. And then we added the Affordable Care Act, and then that also wrapped in coverage for vision and dental. And the care for children in New Hampshire has really increased exponentially because of that. An interest to me for nurse practitioners in particular is rural medical home reimbursement versus federally qualified health centers. So in my town, there's both types. I worked for a rural medical home where we were reimbursed at a higher rate than other hospitals because of our rural access and our commitment to quality care. That was even mandated that there had to be nurse practitioners on site in order to be designated as a rural medical home, and we increased the reimbursement for each of our visits. Across town, there is a federally qualified health center, and they are reimbursed in a different way, and their nurse practitioners are paid with RVU based. So just the difference between a salary-based nurse practitioner who works in a rural medical home and a nurse practitioner working at a federally qualified health center, and how decisions are made about how patients are seen and how often they're seen and what visit types you have and how long you have. It's just been fascinating to watch how healthcare decisions are often driven by economics. Now that I work in a hospital where there is less of the day-to-day input about how we're making money. So in a rural medical home, every month we know, what are we paying our secretaries, what's our salary, what is the cost for plows and cost of electric, and we have to drive enough revenue to keep ourselves in the black. Then you go to a larger hospital where you're working in specialty clinic, and there's no way that we can drive enough revenue to even offset the cost of our own salary because of how lengthy the visits are with patients.